Losartan is one of the most commonly prescribed blood pressure medicines in the world, but most people don't fully understand what it actually does inside the body. Yes, it lowers blood pressure, but that's only part of the story. It can also protect your kidneys in powerful ways, and in some cases, it may cause effects that are easy to miss until they become serious. So before you ignore these signs, let's break down the 7 biggest effects of Losartan in simple, clear language. Losartan is not just for controlling blood pressure. It also plays a key role in protecting kidney health, particularly in diabetic patients. However, it's not completely risk-free. In this video, we'll go over 7 important effects you need to understand. Effect HAG1: lowers blood pressure. This is the main reason most people take Losartan, to control high blood pressure. But here's what's actually happening inside your body. Your blood vessels are often tight and narrow, which makes it harder for blood to move smoothly. This creates pressure. Losartan works by relaxing those blood vessels. It gently opens them up, allowing blood to flow more easily. As a result, your blood pressure comes down, and your heart doesn't have to work as hard. Over time, this can reduce the risk of serious problems like heart attacks or strokes. But remember, it doesn't cure high blood pressure. It only controls it. That's why stopping it suddenly can be risky. Effect #2: protects kidneys, very important. This is where Losartan becomes more than just a blood pressure medicine. It actually plays a powerful role in protecting your kidneys. Inside your kidneys are tiny filtering units that clean your blood. In conditions like diabetes or long-term high blood pressure, these filters are under constant stress. Over time, they can get damaged. Losartan helps by reducing the pressure inside these delicate filters. Think of it like easing the load on something that's working too hard. This helps slow down kidney damage and can even delay serious conditions like kidney failure. That's why doctors often prescribe Losartan early, especially in diabetic patients. But here's the surprising part. Many people don't even realize it's protecting their kidneys while they take it. It works silently, without obvious signs, and that's exactly why it's considered such an important long-term medication. Effect #3: may cause low blood pressure. Now, here's something many people experience but don't connect to the medicine. Sometimes, Losartan works a little too well. Instead of just lowering high blood pressure, it can drop it more than needed. When that happens, you may start feeling dizzy, weak, or lightheaded. This is especially noticeable when you stand up quickly from sitting or lying down. You might feel like the room is spinning for a few seconds. This effect is more common in the beginning, when your body is still adjusting to the medicine. It can also happen if you're dehydrated or taking other blood pressure drugs. While it may seem harmless, frequent dizziness can increase the risk of falls, especially in older adults. So if you notice these symptoms often, it's not something to ignore. Your dose may need adjustment, and your doctor should know about it. Effect #4: increases potassium levels. This is one of the most important but often overlooked effects of Losartan. It can increase the level of potassium in your blood. Potassium is essential for your muscles and heart, but too much of it can disturb your heart's normal rhythm and lead to serious complications. The problem is, you may not notice it early. Sometimes the only signs are mild, like muscle weakness, fatigue, or an unusual heartbeat. And a blood test is the only way to confirm it before it becomes serious. That's why regular monitoring while on Losartan is critical, not optional. Combining it with potassium supplements or certain foods without guidance can increase the risk even further. Effect #5: may affect kidney function in some soul. This might sound confusing at first. A medicine that protects the kidneys can also affect them negatively? Yes, in some situations, it can. While Losartan reduces pressure inside the kidneys, it can also slightly reduce their filtering ability in certain people. This is more likely if someone already has severe kidney disease, dehydration, or poor blood flow to the kidneys. In these cases, kidney function may temporarily worsen after starting the medicine. That's why doctors usually check kidney tests before and after starting Losartan. They want to make sure your kidneys are responding well. The key point here is balance. For most people, the benefits are greater than the risks, but for a small group, close monitoring becomes very important. So if your doctor asks for repeat blood tests, it's not routine, it's actually a critical safety step. Effect, #6. Dry cough, less common than ACE inhibitor. If you've heard about blood pressure medicines causing a dry cough, you're probably thinking of ACE inhibitors. Compared to those, Losartan is much less likely to cause this problem. That's actually one reason why many patients are switched to Losartan in the first place. However, less common does not mean impossible. A small number of people may still develop a persistent dry cough while taking it. It's usually mild, but it can become annoying over time. The tricky part is that people often don't connect the cough to the medicine. They may think it's due to weather, allergies, or a throat issue. But if the cough started after beginning Losartan and doesn't go away, it's worth discussing with your doctor. In most cases, a simple change in medication can solve the problem completely. Effect, #7. Rare but serious allergic reaction. This effect is rare, but it's very important to know because it can be life-threatening. Some people may develop a serious allergic reaction to Losartan. This can happen suddenly, even if you've been taking the medicine without problems before. The warning signs are very clear but often ignored in the early stage: swelling of the face, lips, tongue, or throat, difficulty breathing, or a feeling of tightness in the chest. This condition is called angioedema, and it requires immediate medical attention. It's not something you wait out or treat at home. The risk is low, but the consequences can be severe if ignored. So if you or someone around you notices these symptoms after taking the medicine, act quickly. Getting help on time can make a critical difference. If you're taking Losartan, never stop it suddenly without medical advice. Take it exactly as prescribed, stay well hydrated, especially in hot weather. Be careful with high potassium foods, and avoid potassium supplements without your doctor's guidance. Most importantly, keep up with regular blood tests to monitor your kidneys and potassium levels. These simple steps can make a serious difference. Losartan can be a very effective medicine, but only when used the right way, with proper monitoring and awareness. If this video helped you understand it better, subscribe for more simple health content. And share this with someone you care about who takes blood pressure medicine. It could make a real difference for thee.